Hi, this is Ginger, and you're watching Gnostic Psych, the place where Sean and I talk to you about the arcane and interesting in relation to psychology. Today we're going to be talking about internet gaming disorder. When the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders was published in 2013, the disorder, internet gaming disorder, or IGD, was included in the chapter Conditions for Further Study. The introduction to the chapter stated, proposed criteria sets are presented for conditions on which future research is encouraged. Since the release of the DSM-5, there has been research to show that IGD is a behavioral addiction like gambling. If you want to read more about the research studies that have found that IGD is an addiction, the articles will be in the references section, which are listed pretty much for all the videos we post. But before I get to why internet gaming disorder is addictive, I'll give you a brief history of the study of pathological gaming. The literature from the study of gambling addiction began in the 1980s when some of the first gaming systems were popular, like Atari and Nintendo. The phenomenon was first referred to as video game obsession and computer catatonia. A 1983 study by Soper and Miller first observed that pathological gaming was similar to other behavioral addictions. However, there weren't any studies that contributed to the study of IGD during the remainder of the 1980s and 90s. Research wasn't helped by the fact that pathological gaming was studied using the diagnostic criteria for gambling disorder in the DSM-3 and DSM-4. It wasn't until the 2000s, after video games had made the leap from two-dimensional to three-dimensional first-person shooter games and open-world, massively multiplayer online role-playing games, that the research of gaming addiction really took off. According to Pontes and Griffiths, 60 studies done on pathological gaming between 2000 and 2010 found that the open-world MMORPG, massively multiplayer online role-playing games, has the sensorial capabilities of becoming addictive to players who have addictive personalities. So how do we know that video game and internet games can become addictive? Well, before we go any further, I must point out that like any other recreational activity, there are different types of gamers. Not all gamers engage in pathological gaming. There are 5 types of gamers. You have your casual gamers who only game every once in a while, regular gamers who play video and internet games on a regular basis, but it's not central to their lives. Next, there are the low-risk, high-engagement gamers who make gaming the central focus of their spare time and could become high-risk or at-risk, or even disordered gamers if they're not careful. We have at-risk, high-engagement gamers next, who are already experiencing consequences for their addictive gaming. They exclude all activities they once enjoyed. They may have started to lose friendships and romantic relationships by putting their gaming before the people in their life. Lastly, there are the disordered gamers who have lost relationships, lost jobs, have financial problems from spending all their money on the latest games being released. They may have health problems from poor diet and sedentary lifestyle, poor hygiene, and experience depression and anhedonia when they aren't playing. A couple of neurobiological studies in this past decade found out that gaming activates part of the brain of pathological gamers that are related to addiction. The 2013 study by Ko et al. Used fMRIs to discover cue-induced reactivity to gaming was found in the same part of the hippocampus, which is the lower part of the brain that encodes retrieve memories, as nicotine in the brains of pathological gamers who smoke. A 2014 study by Meng et al. Used the fMRI scans. They found out that the sensorial experiences of pathological gamers, are more absorbing than those of casual, regular, low-risk gamers. The frontal region, in particular the prefrontal cortex, which controls attention, object, facial recognition, emotional processing, and behavioral recognition, is higher activated in the brains of pathological gamers than those of non-pathological gamers. Besides the neurobiological evidence, IGD can be measured by the components model of addiction. The components model of addiction, which is the classification criteria of the DSM's addiction disorders, have been was used for IGD's criteria for the DSM-5. The 6 components which we can empirically determine if someone is addicted, whether to gambling, alcohol, drugs, sex, food, are salience, mood modification, tolerance, withdrawal symptoms, conflict, and relapse. Salience is when a person makes what they're addicted to the central focus of their life. All former hobbies and interests, as well as relationships, are cast aside. Evidence has shown that pathological gamers have achieved salience and when they do, their drive is fairly strong. Mood modification is the effect or effects that persons with addiction strive to psychologically obtain. Basically, it's like euphoria, the rush, the buzz, the feeling of satisfaction. Pathological gamers have been observed to experience mood elevation similar to euphoria while playing. Tolerance is when the addicted person experiences diminished effects from whatever it is they're addicted to. They therefore must increase the amount of whatever they're addicted to in order to experience the same level of mood modification they once enjoyed. The pathological gamer is no different in this regard. The length of time they spend gaming in order to experience the mood elevation they once had grows increasingly longer over time. Withdrawal symptoms are experienced by the addicted person when they are unable to continue feeding their addiction. Persons with IGD have been observed to experience depression, anxiety, irritability, and even anhedonia, which I used the term earlier. It's basically the inability to experience any kind of positive affect. Usually somebody who's so depressed they have no neurotransmitters left tends to be stricken with anhedonia. Conflict is the negative social effect of the person's addiction which they have on those around them, whether family, friends, or coworkers. Conflicts are typically related to the irresponsibility and selfishness tied to the person's salience. Also to their dishonesty, illegal activities driven by the addiction, any violent abusive behavior, or simply a lack of participation in the relationship. As I stated before, gaming for countless hours and even days has resulted in pathological gamers losing relationships in the process. The last component is relapse, which when the person with an addiction both acts on their previously addicted behavior after having experienced a period of abstinence. This should not be confused with a lapse, which is acting on the addicted behavior once before returning back to recovery. This is basically a total return to their old lifestyle related to their addiction. Like other addictions, gamers with IGD have found it difficult not to return to their addictive behaviors. For many pathological gamers, the open world MMORPGs with their picture-perfect graphics, intriguing plots, and sensory overloads are an escape from the anxiety and depression of at-risk and disordered gamers. Huge gains in the literature have been made in the last 10 years as far as symptoms and diagnoses. In recent years, the Internet Gaming Disorder 20 test, or the IGD-20, based off of the DSM-5 diagnosis, has yielded good results as an assessment tool as far as reliability and validity. Its cross-cultural validity has led to the Korean language as well as the Arabic and Spanish language versions of the test. Though treatment for IGD is still in its infancy, there are 12-step recovery groups out there available for pathological gamers, like Online Gamers Anonymous and Computer Gaming Addicts Anonymous. There's still more that psychologists need to learn about IGD, like how many female gamers experience IGD. It is difficult to know since females are still a minority in the gaming community. It is not uncommon for female gamers to choose male avatars in order to hide their female identities, since the gaming community has its share of misogynists and chauvinists. So hopefully the 2020s will lead to even more research breakthroughs on this growing field of study. Well, thanks for watching. If you like this video or any of our other videos, please subscribe.